I think with iron, where we should probably begin is I just want to talk a little bit about like what iron does in the body, I guess.
Mhm. Yep.
So I think the main thing that we think about with iron is like oxygen transportation in the body. It helps your cells get oxygen, which is really important.
Big deal.
Critically, right? A big deal. And there's other things that we can deep dive into on tasks that iron does as well, but that's probably the biggest one. And usually, the symptoms of iron deficiency are labeled as anemia. And there's different types of anemia, which can be a little bit confusing,
Mhm.
where you could have deficiencies in B12 and folate, and those can lead to a little bit different manifestation of anemia, but similar symptoms. But iron deficiency anemia tends to come with symptoms like shortness of breath, low energy, um, dizziness, those types of symptoms. Would you add anything else in particular, Nikki?
Yeah, like an overall feeling of weakness or like your
Yeah.
body can't cope with normal tasks. Like I remember when my mom was really low on iron, just like going upstairs, she had to stop like 4 times going up a normal flight of stairs
Yeah, it's like,
and winded.
yeah, like lethargy, malaise. Like those are the types of words that kind of come to my head. But I think something that there's usually so much going on probably with the clients that we work with where there's a lot of gut stuff happening, and there's a lot of strategies being looked at, and sometimes iron goes under the radar from my standpoint. Like, low energy can be blamed on just SIBO often, or
Mhm.
blamed on a lot of other things like thyroid issues, um, or just runaway stress. So it can just be something that can go under the radar, and I definitely see it's very prevalent in the population that I work with. We were talking before we jumped on air, like I'd probably say like probably 80% of the clients that I work with have iron deficiency of some sort. Maybe it's
Yeah.
not extreme, but a lot of people I'm seeing ferritin like 10 to at 10, which is low.
Yeah.
And in a lot of times, which is interesting to me, and you can let me know if you've had a similar experience, but a lot of docs don't really flag it either. Like they might be like, oh, your iron's low, but unless it's like below 11, I think might be the reference range, which is another area we should probably discuss, is the reference
Hmm.
range in the conventional space. But a lot of docs will be like, oh yeah, your iron's a little low, but like they're not really intervening when I feel like intervention's probably necessary.
It's often missed in part because the lab reference ranges are so absurd. The LabCorp reference range for hemoglobin, as an example, goes down to 11.1, and she was at 11.2. And I was like, ugh, like
Yeah.
that's real close to them flagging you as anemic. They're giving you what they call their reference interval. They don't use the word normal. They don't use the word ideal. It's not ideal
Mhm.
human physiology. That's just their reference interval. And mostly they're basing that off of a big fat bell curve analysis. And they're plotting everybody they've ever tested. And they're saying, yeah, as long as you're like right here in the middle with everybody else, you're probably A-OK. But I always joke with patients, I like gesture to the door. I'm like, have you met anybody ever? Like everybody has an autoimmune disease, heart
Right.
disease, high cholesterol, diabetes, cancer. Like you don't want to be like them. And I love myself included. Like you don't want to base your like goal setting off of that. You want to be more iron replete than normal people in America. And like you want to have less inflammation than normal people in America, right? So like there's some nuance to that, but iron deficiency and anemia just broadly get really underdiagnosed because the lab reference ranges for LabCorp and Quest are absolute rubbish, and that's what doctors are going off of. I also see high ferritin as a marker of inflammation fairly frequently amongst my patients. I
Right.
would say that's probably 20%.
And I will say too, I've definitely seen the high ferritin as well. And I know in the conventional space, we we learn that as like the anemia of chronic disease. That's kind of
Mm.
how it was referred to us in dietetic school. And essentially, what's happening with that is iron's a pro-oxidant, so if there's a lot of inflammation, your body is trying to help control inflammation by like putting iron into the storage form.
Yeah.
But then a lot of times you'll still have like almost anemia type symptoms because there's not enough iron sitting around in the blood. So it's really weird. It's a weird thing when iron gets a little bit elevated, but that might be again something we touch on a little bit too, like
but let's go back over to what is more commonly the issue, which is iron deficiency. And let's start with why that would happen first. So as we alluded to, like gut inflammation and gut stress can do that and really mess with your absorption. And I'll also point out, like, just not eating enough iron also plays a big role. And I have seen those patients where they're vegan or vegetarian and they think, oh, I'm going to get my iron through like spinach smoothies every day. And sometimes that's not enough. Sometimes you, honest to God, need to have either some supplementation in, or you need to eat some animal protein to get that iron up. And that could be a really tough conversation to have. I know that not a lot of people on those plant-based diets want to hear that, but that is something I would throw out there as well. Have you seen that too?
Yeah, I mean, I've definitely seen that. I think that when it comes to vegetarian and vegan sources of iron, the bioavailability is so much lower.
Yeah.
So even if you were being really careful from a dietary standpoint, eating things like beans, which it would be hard if you were having gut issues, but eating things like spinach and chocolate or things that have a lot of iron in them from a vegetarian vegan sources, the absorption's usually worse. The bioavailability is not as good. Yeah. So even if you were really paying attention to it, there's a chance that you still might not be able to get enough in. And then, like you're saying, if you have gut issues on top of that, it makes it even more challenging. So you're kind of the cards are stacked against you, so to speak. And I do think that the gut side of things as well, with iron, certain microbes can really steal iron from you. In a way, they're a little bit pesky, pesky thieves in the gut. So iron can be utilized by, iron can be utilized by a lot of microbes. So that could be a factor in there as well. But yeah, it definitely gets tricky because it's certainly a nutrient that I think if you're not absorbing well, can have a huge effect.
I have had cases, before I've worked with people, like with celiac disease, for example, or SIBO, where like they've been aware of the iron deficiency, they've been trying to work on it to no avail. And I've got a couple tricks up my sleeve for those kind of situations. I don't know if you have any as well, but what I've seen a couple times is every now and then I'll bust out the iron patches, but not typically for that sort of a case. But what I've also seen really helpful is if you space the iron supplement out every other day, instead of taking it daily. I forget the exact mechanism, but your body basically puts the kibosh on your absorption after a while because your body knows that too much iron could be a bad thing and inflammatory. Yeah. So after I think it's 24 hours or so, your body starts to inhibit absorption if you've had an excess prior to that. So like if you take an iron supplement on a Monday, by the time Tuesday rolls around, your body is starting to downregulate absorption. And then if you take it every day for months or years, it's like you're not getting the most bang for your buck. So instead, what I'll have people do very frequently is take either a single dose or even a double dose and just time it every other day so that you allow your body's absorption to kind of reset in the middle there. And then that actually works really, really well. I've also gotten a lot of mileage out of, I always forget the strain. It's whatever probiotic strain is in Jarrow's Ideal Bowel Support. I think I'm going to Google it right now because it's going to bother me if I don't remember. It's 299V. I can never remember what the species is though. What the devil is this? Lactobacillus plantarum, 299V. That bacteria specifically increases iron absorption in humans. So cool. I've used that, and I'll have people take the probiotic every day, but then pulse the iron every other day, typically. And that usually works pretty well, even for resistant cases where they're not absorbing their iron very efficiently. And then, like I said, if we need to, we could slap on, an iron patch or change up the type of iron that's given.
Right. Yeah, I wanted to circle back too to you talking about iron and food as well. Because I think, sometimes there is a dietary reason why you're low in iron as
Yeah.
well. Like what we were saying before, and it's not even vegans or vegetarians. Maybe you just don't eat a lot of red meat or don't eat a lot of iron just in general. And that's always going to be there if that doesn't get correct. Like it's one thing to go then replete the iron, but it might just become deficient over time the longer you're dealing with it. And so that I think is important. I think again the main thing I tend to focus in on if someone's iron deficient, there's a couple things. I think the form is important. So typically I use heme-based iron supplementation.
Yeah.
I tend to see a much bigger effect with that. Sometimes I'll have people make sure that they're taking it away from calcium. Foods that have calcium tend to bind to iron. So anytime you kind of want to separate those if you eat dairy or things that are iron or that are rich in calcium, I should say.
Or if you take an iron supplement. Like I can't touch dairy with a 10-foot pole, but I take calcium as a supplement.
Right.
Spacing that out.
Right. Yeah. So definitely spacing iron away from calcium's helpful. I also like to clue in on like periods and cycles because I tend to work. Yeah. Yeah.
Oh yeah.
So I think that's really big, especially in the women that I work with. Because iron really, for women, if they're premenopausal and their cycles are really heavy, I mean, that's something that almost has to be fixed because that's a huge reason why you're losing a lot of iron.
It
So
can be the reason.
Right,
honestly,
right. So a lot of times I'll definitely ask about that, get some more information about that, and we'll kind of work on things that could help with that underlying cause. But yeah, that when the cycles are really heavy, and a lot of times there's reasons for that, like inflammation and gut imbalances and hormonal issues from just the stress and inflammation going on in the body. But yeah, I think getting cycles more, I'm trying to think of a good word, less heavy and more regular and normal, which is always hard. It's always funny to me too when like a doctor, asks you like, how are your cycles? Are they heavy? But it's like hard to know because you're only in your body. So you only like, have one reference point, but then you can kind of get a gauge on like how many tampons or pads you're using.
Exactly.
But it is funny, like sometimes if you're talking to someone who's had like really heavy periods for a while, like their normal's very like their reference point's very off in terms of what's like normal.
Their reality set point is like shifted in one direction.
Right, exactly. So which it makes sense. Like I said, you're only in your body, but getting a gauge on like the heaviness of your cycles and if those need to be worked on and kind of digging to the root cause of what's driving that, I think is really important when it comes to iron. Yeah.
And we probably should have started the episode with this, but I'll say it now anyway, is that literally nothing in the body works without oxygen.
Right.
None of it. Nothing. With the exception, your microbiome actually like does better in an oxygen devoid environment, aka like the colon. But your actual tissues, everything from, your toenails to your thyroid to your eyebrows to your pancreas, everything needs oxygen. And that's where I see it being a catch-22 also is that, like, say we take SIBO, which is, I think I've said this before on this podcast, if not, I think SIBO is inherently a disorder of dysmotility above all else. Like something had to crap out your motility to get you the end result of SIBO. So motility is always on the radar of what I'm talking about with my SIBO patients. Well, guess what? Your vagus nerve, your gut-brain axis, your parietal cells, like the cells that make juices for you, the cells that regulate motility, they're not going to work if they don't have oxygen. It's kind of a deal breaker for like the whole body. So it's one of those things that like and to his credit, I will say, any practitioners who have trained at all with Datis Karazian have zero excuse for never checking iron, because he, in like all of his classes, at least that I've taken, right up front, he says, look, the deal breakers, blood sugar, oxygen. You don't have those two things and they're not stable and doing good, all shit's gonna hit the fan and all hats are off. So,
Right.
I think he really drills that into the people that he trains, thankfully. But like nothing works. I mean, it's almost, I don't want to say it's almost useless, but it's almost like silly to talk about, healing the leaky gut or treating, the hormones or managing your adrenals if your whole body is starved for oxygen. Hey guys, if you like this video, be sure to subscribe, ring the bell, click the like button, and leave a comment down below with the videos that you would like to see me do next. Doing all of those really helps support the channel and support my efforts in making as many videos as possible for you guys. Thanks so much, and I'll see you in the next video.